In accordance with Section 32, subsection 1 of the Disaster Preparedness and Relief Act of 1991, I declare a state of national disaster in respect of all the districts of the country with effect from today, January 12, 2021. I therefore appeal for more assistance from international community, relevant United Nations agencies, non-governmental organizations, and the private sector for uncommon contributions towards the resources needed to meet the present challenge of the pandemic.
Following the declaration on the state of emergency due to COVID-19 by the head of state in Malawi, Serve the Children Malawi, with assistance from European Union in the ECHO project, has been distributing personal protective equipment and providing a series of trainings to the rural masses through CARE Malawi, Go Malawi, and TROCAIRE in 4 districts, which are Mwanza, Mulanje, Mangochi, and Blantyre. Lying at an area covering 12 square kilometers in the tropical climate district Mwanza lies Kunenekude area. For many years, the area has been rich in agricultural economy. The area depended on citrus fruits such as tangerine, lemons, and grapefruits, as the district is one of the few areas in the country where climate is favorable for the growth of such citrus fruits. Yes, visiting the area was one of the moments that no one would miss home. Fruits everywhere. However, for over a decade, production has been falling down, and the citrus farming has been on the decline despite efforts by the Citrus Growers Association in the area. On why there is such a decline, that's the story for the other day. Today, we are concentrating on what Save the Children through ECHO project is doing in response to a call by the Malawi government in the fight against COVID-19 pandemic. The disease has claimed a lot of lives in the country. Mwanza is no exception. We are covering a distance of 18 kilometers using this road to Kunenekude Health Center, located in the traditional authority Kanduku, where we are to appreciate this initiative. This is our destination, Kunenekude Health Center. The health facility serves 18,571 people within the area, Neno District and Mozambique. It provides maternal care, outpatients, and health-friendly services, among others. From the look of things, the facility is overcrowded with patients coming to seek assistance. This situation puts the facility on a high risk of COVID-19 transmission. In order to minimize the risk, Serve the Children Malawi came to their rescue.
We were assisted with wash supplies. This includes buckets, soap. We also got test kits for water. That is, we do tests if maybe the water, we look at the bacteria that are found in the water, or if the water does contain chlorine. So it has been of help since, with COVID-19, we are supposed to wash hands frequently. We are supposed to distance ourselves from others by 1 meter apart. So with this help, we are able to tell our patients to wash hands, because with the buckets that we received, we got soap. So we are able to wash hands using soap. And apart from that, in this project, we've also been assisted with a water tank. As previously, we had challenges with water. So with the ECO project, when they came presenting us with the supplies, we asked them for help in terms of water, since we do not have enough water for the facility to carry us through the day. With their help, they have assisted us with a tank that is yet to be installed. They are also buying other supplies like solar power, since the water that we get we do pump through solar. SAFE has also assisted us in training staff members. You see, when the COVID-19 came in the early months of March in 2020, there were a lot of rumors circulating, but then SAFE came along, assisted us with training, so each and everyone on the facility was trained according to the cadre of the person. For instance, nurses, midwives, technicians, as well as medical assistants were trained in case management, where we have we learned on how we can treat cases, on how we can screen for cases, and on how we can track the cases.
Anything that one plants or sows, it has to bear fruits. The fruits can be good or bad. Save the Children Malawi has planted. In terms of COVID cases, should we say the health facility has registered any since the support?
As of now, I can say no, we have not registered any case, but we had suspects, of which when we had them, we had to send them to Mwanza District Hospital as our main facility. So we were told, we had the feedback that the patient was found COVID negative. We had a lot of suspects, I can say, but all of them turned out to be COVID negative.
News worth smiling. One of the preventive measures that the Presidential Task Force on COVID-19 recommended is to avoid staying in crowds and observing social distance. Kunene Kude Health Center is of no option but to comply. How is their question? Their nature of work involves attending morning sessions for briefing and trainings that can help the facility and the community at large. This is real a hassle to them. God bless Save the Children, who through ECO Project came to the rescue by introducing webinar sessions that enables them to participate as a team in different sessions within and outside Kunene Kude. This is great indeed. Despite this good initiative, the area has poor network. This makes them fail to participate in other important sessions. However, within Kunene Kude Health Center, the sessions are carried out.
Currently, the fourth reading cause of death worldwide. This report was produced by God in 2020. So you can see that COPD has been added into this COVID-19 presentation just because it is a leading cause of death.
Though the donation is meant for health facility, the community is the ultimate beneficiary. Indeed, the facility is turned into a training school for the community. It is time to say bye to Gunenegude Health Center. Sharing experience after appreciating the initiative is part of the journey. We are now heading to Mwanza District Hospital for another experience. Remember, the project's priority is the health facility, so we head straight there. Our driver, Bright Maka, is doing what he knows best for us, to be at the hospital in good time. Bright, slow down. What is happening in front of us? What if one has no money to pay and is rushing to the health facility? What happens? Okay, keep your response to yourself. Let us continue with our journey. Being the main hospital for the district, it receives additional equipment befitting its status, and it manages to minimize COVID-19 cases.
We only have one active case in the community, no case in the ward, in the ETU. That we attribute to the help that we've received from Save the Children Eco Project, as well as the cooperation that we've had with the workers themselves, the frontline workers. We've saved the children. You know, to do better in disease surveillance and control, you have to do contact tracing. Also, Save the Children helped us in contact tracing. We managed to train over 50 frontline health workers who were able to do contact tracing, which is very, very important in combating the disease. As well as we also had to trace 287 cases from the 207 contacts of the 175 cases. We had 775 confirmed cases, and we needed to follow up about 207 contacts of the cases. That was possible because Save the Children Eco Project came in to help us to carry out the activity. That involves travel, fuel, and the like. We were also able to engage with the community with the support from Save the Children. We had several means of engaging the community. The approach that we used in engaging the community to raise the awareness on COVID-19. We used the route hearing, vehicles that were moving around, giving out the messages of how to prevent yourself from contacting COVID-19, what you should do in case you are infected. We also engaged with burial teams. We managed to train burial teams in the district as per each and every group village headman. That helped us to raise the awareness of the community, as well as getting their cooperation in implementing the needed preventive measures to control the spread. We also engaged the community leaders. We trained some community leaders with the help of Save the Children. That helped very much, as community leaders are the gatekeepers of the community. So when you approach them, you let them understand what is there. That actually helped us a great deal in managing and preventing the further spread of the pandemic.
Should we say this is all?
You may be aware that Mwanza is a border district, and all the people that are coming from South Africa and the like are actually coming from here. They are passing through Mwanza. Eco Project also came into our help in that aspect. We need to manage the people at the border. We need to test them. We need to sensitize them. So Save the Children actually helped us also with a campaign to sensitize those that are coming in through the borders. That also helped us to raise the awareness, and as even those people are getting in, they shouldn't further spread the disease if at all they had such kind of a disease. Another primary measure of preventing the disease, as you may be aware of, is hand washing. In that area, Eco Project also helped us. In raising, we had campaigns on hand washing. We conducted about over 10 campaigns across the district on promoting hand hygiene. Even as of now, we have not experienced any cholera case. In fact, it's related. You look at no cholera case as far as it is up to this time around. This is also attributed to, among other things, is attributed to the campaigns that we've been having across the district, supported by Save the Children. We had also a problem that concerns hand washing. Our tanks at the very facility at Mwanza District Hospital, we had problems with our tanks. Eco Project came to our rescue by repairing the tanks, 2 of them that at this point in time they are actually running very well. That has enhanced the availability of water in the facility here so that people could wash hands. You've seen buckets as we were coming in. That has been able because the project came in to help us. At one point in time I was talking about the management of RSA returnees according to COVID-19 protocols. At a point in time, we had no water at the port of entry. But Save the Children, Eco Project, and other partners came in and provided us water bowsers that enhanced the hand washing facilities that we needed to have at the port of entry.
Considering that the health facility and the hospital are the next places for COVID-19 cases, Save the Children Malawi decides to work with the origins of the disease, which is the home in the community. Patients come from the village. Tambani is another area in the district that is benefiting from Eco Project through Save the Children Malawi. The area is located 26 kilometers away from the district administrative offices, and it has a population of 19,779 people. This is the Area Civil Protection Committee in the heart of Traditional Authority Govati, Minjale village. The committee received different PPEs from Eco Project to enhance their work of sensitizing the community on COVID-19.
First of all, people were not able to know all about the community lead action, but now through the project of Eco that Save brought here, people are now able to understand their law, and they are also able to partake the areas that they are supposed to take. For example, we have a neighborhood unit in the Sembenzera area, which is very close to neighboring Mozambique country. In this area, we have more people who trespass. So because of CRA, that is community in action, people organize themselves, have a community bordering, whereby they inspect people who are trespassing from Mozambique to Malawi through the COVID-19 ways of treating how to prevent COVID-19. So people are able to know or get organized and make those people who are trespassing to follow the rules which can help not to spread this COVID-19.
Go Malawi, as one of the 3 partners that Save the Children is working with in the COVID-19 response initiative, is working in Blantyre district, especially in Traditional Authority Kapeni and Machinjiri. In addition, it is also working with the District Council Office through the Office of Planning and Development.
As a district, we lobbied with the team to start from the identification of community leaders. As you know, the kind of approach that they are taking is a community-led approach. So with the approach, what it meant is they have to go to the community, and the community identify their own problems, and then they actually deal with the problem as such. But then it was a project, so it was only targeting a particular area, that's the COVID-19 response. So we went to the community and then did the sensitization, and then the community came to a point where they understood that the COVID is a problem or a challenge amidst them. Then from there, the action plans were developed into how they can tackle the COVID-19. Later on, the district team, after scrutinizing the plan and having inputs from several stakeholders, the VCPCs and the SPCs were actually oriented on the same, and the sensitizations were also done. And after that, we managed to identify some of the what technically would call champions of the same, and these started following up on the ground. So primarily, what I would say is the project has assisted the district in terms of awareness on COVID-19, capacity building of relevant structures on COVID-19, and also supporting all these necessary structures with the PPEs.
Apart from the district council, just like in Mwanza, Blantyre District Health Office is also a beneficiary of the project. Blantyre District, being a commercial city, is one of the most hit districts with COVID-19. As a result, it needs more resources, both monetary and material support from well-wishers. No wonder Save the Children through CARE Malawi avail themselves for this need. The Blantyre District Health Office receives a number of PPEs, oxygen cylinders, masks and trainings of members of staff, among others.
Zatithandiza kwambiri chifukwa chiwerengero cha COVID-19 panopa ku Blantyre ndichotsika kwambiri chifukwa ma healthcare workers anzathu ogwira ntchito za umoyo amadziwa amene angazisamalire, komanso amatha kwa mapatient amene amakanika kuti angakhale kupeza ngati mamaski amathandiza, komanso zathandiza kuti maklayenti wakavala mamaski bwinobwino akasamba m'manja zichepese ku chiwerengero chotenga kachilombo ka COVID-19.
Our next destination is Chilomoni Township, the first urban area in this program to benefit from ECO project. In Chilomoni, we are meeting the Civil Protection Committee and the coordinator of COVID-19 at the health center. The venue for our meeting is here. The committee is working day and night to ensure that people in the area are safe from COVID-19. They are disseminating COVID-19 messages that were gathered during the trainings that Save the Children through CARE Malawi provided. The trainings are one of the packages that was provided to the area through ECO project. Is there any impact that the township is seeing?
The messages actually are effective, because I remember when we had a meeting in early February, actually, we discussed about some of the challenges that the committee, as a committee, actually were facing. People were afraid to go to the health center or maybe to seek medical help when they see some problems, or maybe they see that they're having a certain challenge. So it's like we went to the community, and once we started communicating the messages to them, actually, so that after they should be coming to the hospital, and those rumors actually which were going around, actually were able to share much information, the facts, and people were able to get help. So the changes are here, whereby people have now started coming to the hospital, seeking for medical help, other than just staying in their homes when they're sick.
The donations also help the health facility.
These things have helped us to reduce the numbers of the COVID-19 patients, because since we are using them before entering at the hospital, every patient has to wash hands before seeing the doctor. Apart from that, we also teach the community so that they can use that buckets. They should put their own buckets at their houses so that they can also practice the hand washing. That can prevent the COVID-19.
From Chiromoni, we head to Mlambe Hospital. This is a mission hospital. The journey takes there to appreciate what Go Malawi is doing in reducing the burdens that the hospital encounters due to COVID-19 pandemic. This hospital serves people from different areas within and outside Blantyre district. In the absence of the Blantyre district hospital, Mlambe acts as such. No wonder Save the Children through Go Malawi decides to assist it. The project has donated a good number of buckets that the hospital is using for hand washing, oxygen cylinders, soap and trainings, just to mention a few. What is the situation like after this donation?
We have experienced that currently, now should we say 2 to 3 weeks now, indeed cases have decreased. Previously, we are having a lot of COVID suspects. They are being tracked at the screening point, and also being a testing center where from there at the screening point many were referred to be tested. But now we find that cases have decreased because even a week is passing without testing anybody, because almost all those people who are passing through the screening, they are not presenting with the symptoms to age clinicians or medical personnel to send them for testing. So that is a good sign to say indeed cases have decreased. We used to have even sometimes as a sign to say that indeed there was a big challenge. We could have a lot of brought-in deaths. Those dead bodies which were brought, maybe when they were coming, they thought maybe this client or patient was just unconscious, but after examination at the screening area, they were being declared that no, this one is a brought-in death. So we are receiving a lot during the night. But now, as I have said, in these 2 to 3 weeks, this has reduced.
What was the situation like before this donation?
Before ECHO came in,